rhythms and overall health. A lot of negative healths, right? Negative impacts on your health. You can develop breast cancer, prostate cancer, diabetes. I mean, nothing good comes from it. And so, what can people do in order to prevent that? So, I would say first one, turn off all the lights when you go to bed, right?
That's right. Sleep in the dark. That's
Sleeping
good.
there.
In other words, use light-proof curtains so that you don't have street light coming in through the windows, and switch off the lights in the bedroom at night. Get out in the morning to get exposed to a good dose of natural daylight or sunlight in the morning. And why I say the morning, by the way, it's interesting. One of the side effects is when people have too much light during the nighttime and too little during the day, is there's more depression, anxiety, more psychiatric illness occurs. And fascinating studies looking at patients admitted to hospital for severe depression and other psychiatric disorders. And one half of them are in rooms facing in a hospital wing, facing south and east, so they get the morning sunlight. And the other half of the people on the same hospital ward floor are getting windows facing north and east, and so they don't get the morning sunlight. And guess what? The patients with the same treatment, same doctors, same therapy, same drugs, get out of hospital in half the time when they have exposure to morning sunlight. Very critical.
No
So morning
way.
sunlight is really critical in terms of your mental health, but also your physical health. And so really the rule is get out every morning outside and take a walk, run, whatever you do. Even sitting outside on the deck or patio is just fine.
That's insane. Half of the time they get out of the hospital.
Right.
Isn't like in Sweden, Finland, those countries where like half of the year it's super dark and the other half of the year is like super bright. Don't they have like high risks of depression as far as
Yes, they do. Yeah, they do. Yeah, I know. There is a significant problem with when you live too far north, above about 50, above about 55 north um, latitude, then in fact it's much harder. And so then you really want to be able to control the very critical then if you live in a northerly latitude to control the bedroom, like, darken the bedroom and make sure you got really super blackout shades and so forth.
is there anything else that they can do, or can they? I I mean, they cannot stay on antidepressants their whole life, right?
Right. Well, it's sort of it's harder, and it has more disruptive effects on circadian rhythms if you're up especially above the Arctic Circle. Um, so that's very disruptive. So normally most of us are in more moderate latitudes, and so we have seasons of the year, but nothing too extreme. But that's one of the things that's really critical, just managing that light. And I think, we know that young girls start their puberty and the menstruating earlier, much years earlier these days than they used to. We think that's something to do with the light exposure they're getting, artificial light exposure. The world's a very different place before the electric light was developed.